The ACT's emergency room waiting times are among the worst in the country, and in the lead up to the election, both major parties have announced policies to reduce the strain. Both Liberal and Labor parties have proposed the construction of clinics away from the hospital grounds for non-critical illness and injury, and also to increase access to GPs. The Labor Party plan to construct a nurse-led clinic modelled from the clinic already at the Canberra Hospital, whereas the Liberals plan to take it one step further with more doctors and an X-ray capability. Being a qualified healthcare professional, the Minister for Community Services, Joy Burge, is familiar with the role nurses play in their field.
Being a nurse myself, I have a lot of faith in nurse practitioners and the role nurses play in our primary health care.
The Shadow Minister for Health, Jeremy Hanson, believes that it is unrealistic that a nurse-led clinic will have the necessary capabilities.
As we've seen in the nurse-only clinic, very well-qualified nurses are limited in what they can do simply because of the protocols that surround what different clinicians can do.
The Liberals have proposed the construction of 2 urgent care clinics, one in Tuggeranong and the other in Gungahlin. The clinics would typically serve patients in triage categories 4 and 5 who are considered to be suffering less severe illnesses or injuries.
Triage categories 4 and 5 are for semi-urgent and non-urgent cases. These are the sprains, the minor breaks, the illnesses that are not requiring hospitalisation, whereas the more urgent categories will be dealt with by the emergency department.
Jeremy Hanson believes that having doctors and nurses working side by side will help them work to the best of their abilities.
By putting nurses and doctors together and enhancing that with a X-ray capability and limited pathology, it actually means that people visiting the clinic will actually be able to get treated for far more conditions than they currently are able to.
The similarities between the 2 proposals have not gone unnoticed by Joy Burge.
I shake my head with a level of amusement at the Canberra Liberals announcing our urgent care clinic. They have spent the last 4 years saying how bad a nurse-led clinic is. What they're effectively doing is following our model, but they're putting paid GPs in there.
Within the ACT, there is a shortage of 140 general practice doctors, and the rates of bulk billing is well below the national average. The Liberal Party has announced that they will provide $5 million in support for GPs if elected. The plan will see support for practicing GPs and would also attract new ones to the capital. This could benefit recent agreements reached by Joy Burge, Bendigo Bank and the West Belconnen Health Cooperative. This agreement will see the health co-op move from North Canberra into the south with the establishment of a bulk billing GP clinic in Chisholm.
So I have worked with the West Belco Health Co-op, and they will come down and open their first service south of Canberra. It'll be here in Chisholm.
With a strong focus on improving primary health care from both major parties, regardless of the results of the election, it is clear that in the coming years, Canberrans will see a significant change in the way they access healthcare.